Okay, so hopefully y'all can see the TV screen with my PowerPoint on it. Hopefully you can read it. So my name is Autumn, as you all know, and for my topic, for the rare disease topic, I chose Rett syndrome. And so what is Rett syndrome? Rett syndrome is a neurological neurodevelopment disorder that affects predominantly females. It's found on the X chromosome, so there are a lot more females that are affected than males. I read in several of the scientific papers that there's no males with Rett syndrome, so I believe that the mother's body will reject the fetus before it is born, because I don't think the males can survive with Rett syndrome, but the females can. And so this disease was first talked about with a Vietnamese pediatrician, Dr. Andreas Rett, and I have his picture here. Hopefully you can see it. And this disease is so rare that it affects 1 to every 10 to 15,000 births each year. There is not a lot of information, like there's not an exact number about how long these children will live with this. A lot of them live to their around 40, mid 40s, and then there was only one that lived to their 50s. So there's a lot of ongoing research about what age you can expect the female to die. So there's 4 stages. Stage 1, 2, 3, and 4, with 4th being the worst. And stage 1 is just showing some signs and symptoms of it. And it's caused by a mutation in the MECP2 gene. And this MECP2 gene controls proteins, MECP2 proteins, and it affects gene expression, metabolism, and it can be, this mutation can just spontaneously happen to children who are born, or it can spontaneously happen and then it be inherited and passed down from mother to daughter with direct transmission. So the causes, like I said, the mutation in the gene MECP2 affects the proteins of it. And so it happens on the X chromosome. It's an X-linked dominant trait. And I have a picture of a healthy cell and a mutated cell. And here's the normal protein on, or the normal gene on, and the mutated one off, and the normal one off, and the normal one on, or the mutated one on. So it's hard to tell that this is mutated unless you do like a genetic testing. And so this protein acts as a biological switch for gene expression, metabolism, and neurons. And so that's why this disease is a neurological neurodevelopment problem, because it affects their neurons, and there's neurons everywhere, and it affects the brain and the metabolism. So that's why these kids are skinny and frail looking. And it binds to the cytosine on the DNA, and MECP2 proteins are found all over the body in the tissues. It's predominantly found in the brain, the heart, and the stomach. And so these kids that have the Rett syndrome have problems, brain problems, cardiac problems, and stomach and intestine issues. And we'll learn and talk about those in later. So some of the signs and symptoms. So parents usually notice that there's something wrong with their child around 6 to 18 months. Because when you compare them to a normal child, you can see that there's something drastically going on. So usually it's seen around 6 to 18 months in female children. And so they will have a slow or decreased motor development and communication. So a lot of times these kids will not crawl, will not walk, will not talk. And sometimes they can, and so the parents think that they're fine, but then there's a drastic decrease in all of this to where they will do it, so where they will not crawl, walk, talk anymore. And there's a lot of increased stereotypic movement. So there's a lot of hand wringing, hand washing, hand flapping, tapping, clapping. And you can see this in the first thing. And it says repetitive hand movement, flapping and clasping. So they're always moving their hands, ringing, etc. And so that is something that parents notice. And there's a loss of purposeful movement, like walking and crawling. They will not do any of this because their muscles are affected by this. There's compulsive hand wringing, like I said, washing, hand movement. There's a slow growth and head growth development. Because this gene and proteins are found all over the body, it affects a lot of them. And so a lot of these kids are very tiny. They don't grow compared to a normal child. They have a loss of eye contact, and it's not because they don't know who you are or know who their parents are. It's just that there's stuff going on neurologically that affects these children like that. There's no crawling. They don't have any interest in toys. There's a rapid loss of speaking. A lot of them do not speak, or if they do, it's very, very, very little. And you can see that this little girl is, I'm not sure her age, but you can see she's in the wheelchair, and she's very tiny and skinny, and you can tell that there's not something quite right with her. And so this is what Rett syndrome does. It puts kids in wheelchairs, and they're not able to walk or crawl. So how does it affect the body? Because these proteins are found in the tissues, a lot of them around the brain and the heart and the intestines, they suffer with brainstem functioning, and this can cause like scoliosis. So that's why a lot of them are in the wheelchair and have like a bowed back. It affects their heart neurons. So a lot of these children will suffer from cardiac problems. And one of the deaths from Rett syndrome is actually cardiac arrest and breathing issues because their heart is affected by this. They have stomach and intestine problems. So a lot of these kids are very skinny and frail looking because they're unable to get the nutrition that they need. So they're malnourished and they cannot maintain their weight properly. Muscle movement is affected because these proteins are found in our tissue all over our body. Of course, our muscles are going to be affected. They affect their sleeping pattern because they're unable to have fun and do normal things like normal children are, and they're hurting, and they're in pain. So a lot of times their sleeping patterns are affected. They have a hormonal imbalance because of this mutated gene affecting their proteins, because their proteins are unable to work properly. They suffer, like I said, from sudden death, cardiac arrest, because they have cardiac problems. They can have seizures, that they can be malnourished and become constipated because they're not getting the nutrients that they need. And a lot of times Rett syndrome can go misdiagnosed for a little while. So when they're diagnosed younger, sometimes they can be diagnosed with autism, because Rett syndrome has so many similar symptoms as autistic, but they're not the same thing, and they're not suffering from autistic disorder. They're suffering from Rett syndrome. And so as they get older, then the doctors and researchers realize, oh wait, there's something wrong. There's a mutated gene somewhere, and this is Rett syndrome, not autism. So for diagnosis and treatment, there's no cure for Rett syndrome, as with a lot of other rare diseases. There's no cure. Diagnosing is parents observing their child and knowing something's wrong, and they take them to the doctor. So the doctor will observe them and watch them to try to figure out what is going on. And then they'll do a genetic test to test for mutations in the genes. So no cure, only treatment offered is to help with their symptoms. So a lot of these kids suffer from seizures, so they're on seizure medication. They have heart problems, so they're on heart medicine. They have breathing issues, so they're on stuff to help with them breathing. So there's a lot of medication that these kids are taking just to help with the signs and symptoms. And they will go through occupational therapy, physical therapy, and communication therapy. And they will be on these therapies for the rest of their life because they cannot care for themselves. They cannot live without somebody. They need a caretaker who's with them 24/7 to help them. So they go through a lot of these therapies to help their body and somewhat feel normal again. And so they'll have these therapies all through life. For inheritance, so Shannon et al. Talked about inheritance in her scientific paper. And she found overseas there was a mother, daughter, aunt, niece, and half-sister affected from Rett syndrome. They all had the trait. And so she found that this was, in fact, an X-linked dominant inheritance. And it was passed down from direct transmission. And she found, like, we've been talking about this in lecture, she found that this was caused by germline mosaicism. So the grandmother had this and the mother had this, and ultimately it was passed down to the second generation daughter. And it's an X-linked disease and direct transmission. And so I have a picture of a Rett syndrome X-linked chromosome, and you can see that there's the MECP2 gene, and here's the affected one. And it's a mutation in that gene. So we've been talking about mapping in lecture, and then in Shannon et al.'s paper, she talked about exclusion mapping and how this helped them to determine the exact disease gene that was going on, the mutated gene. And exclusion mapping helps localize these genes that have been mutated and that are causing problems in diseases. And so what I found interesting was it said that exclusion mapping helps find more information and more information about the genes that are affected rather than regular standard linkage studies. And because this is a rare disease, there's always ongoing research happening. Because doctors and researchers and physicians are unable to give an exact number of how long the patient or the child will live, there's not a lot of information on that. So they're always researching every single day to help find that life expectancy number so that they can warn their parents of when it's coming. But a lot of them lived till they were 40s, so they lived a pretty good normal life, I guess, up to that age. They lived to adulthood, but they didn't make it past there. And so a lot of bioinformatics researchers and physicians are always doing research, and they want to find a drug that can help target certain areas in these symptoms to help these children, other than just treating their symptoms and hoping for the best. They want to find a drug that will treat all these symptoms and that will help these children. They want to find something to reduce their symptoms and their severity so they won't be in so much pain and can somewhat have a normal quality of life. And because mutations occur every single day, we've learned that mutations can occur very easily in something that has gone on in meiosis and the crossover, like we know that. And so researchers and scientists are constantly researching mutations that occur every single day so that we can have, the public can have more information on these mutations that occur. And so that's the end of my PowerPoint, but the main thing I want you to take home from Rett syndrome is that it predominantly affects females. There's no males in the world that have Rett syndrome. It's an X-linked dominant inheritance. It's found on the X chromosome. It's caused by the MECP2 gene mutated that affects the MECP2 proteins that are found in tissues all over our body, and especially in the brain and the stomach and the heart. And so that's why Rett syndrome patients experience heart problems, malnutrition, scoliosis, neurological neurodevelopment disorders. And it can be inherited, but it also, there's a 1% chance that it can be inherited from mother to daughter, like in Shannon et al.'s paper. But then 99% of the cases are passed, or it happens spontaneously. So like they can have two unaffected parents, and during the crossover and meiosis, etc., they can produce a child that is affected by Rett syndrome, but it can be inherited. And so that's what I want y'all to take home from this. And thank you, and I hope that you can read my slides on